Since 1971, the Kansas Hospital Association has recognized individuals who demonstrate distinguished service and outstanding contributions to the field of healthcare in Kansas with the Charles S. Billings Award. Dennis A. Hachenberg, the 36th recipient of this award, has certainly demonstrated these qualities during his devoted healthcare career of 50 years. Denny was born in 1946, the first year of the baby boom. He grew up in the Kansas City area with his younger sister Sue and his parents Newt and Vanita. Denny was active in Cub Scouts and Boy Scouts and was a catcher on the Penn Central Oil baseball team. Denny began his career in healthcare in 1963 while he was a senior at Shawnee Mission North High School. His next-door neighbor was a department head at Menorah Medical Center and encouraged him to get a job at the hospital as he told him it beats working at a gas station in the winter. So Denny started his career as an inhalation therapist. He learned the profession on the job, working throughout his college years. He received his Bachelor of Science degree in Sociology and Psychology from the University of Central Missouri in 1968. He later received advanced training in respiratory therapy at the University of Chicago and a Master of Arts degree in Healthcare Administration from Webster University. Denny worked in a variety of healthcare positions until 1974, when he took a position as the Director of Respiratory Therapy at St. Luke's. This began what would become a 40-year career with St. Luke's Health System. In 1992, he became the Director of Outreach Services and advocated on behalf of community hospitals and physician practices within 100 miles of Kansas City. In 1999, Denny was named the Chief Executive Officer of Anderson County Hospital in Garnett. In this role, he has become a peer resource to many hospital CEOs across the state. He is frequently called upon as a personal coach, mentor, and confidant to both executives and physicians. With a keen focus on quality, Anderson County Hospital has moved to take its place among the top-performing hospitals in the state in terms of patient satisfaction. Its performance on the Medicare clinical core measures is consistently strong. Its long-term care center has been recognized as a 5-star facility by CMS since 2008 and is a quality leader in the state of Kansas for nursing care facilities. It also has received the U.S. News and World Report recognition as among the best centers in the nation for 5 consecutive years. Anderson County has benefited greatly from the hospital's initiatives to improve the health of the population. Under Denny's leadership, a hospital-led initiative, 60 Years of Service, 60 Days of Wellness, was launched during the celebration of the 60th anniversary of the hospital. The initiative was very successful in raising awareness and helped to define a community-wide wellness initiative for the county called Go Anderson County. Over the years, Anderson County Hospital has developed a strong, competent team of physicians and staff. But the hospital's physical plant was one of the biggest barriers. Denny worked tirelessly in the community to raise awareness for upgrades and replacements, and was successful in renovating the hospital in 2002. But a long-term solution was still needed. So Denny, his board team, and his hospital team set out on an exhausting campaign to gain the approval of St. Luke's Health System, the Anderson County Commission, and the Anderson County taxpayers to build a new hospital. All were overjoyed when the county voted to approve the new hospital. Groundbreaking took place in August of 2013, with the new facility set to open in January of 2015. Denny has been an active advocate on behalf of hospitals in Kansas throughout his tenure as CEO. He's made many personal visits to Topeka to advocate directly to lawmakers and regulators. Denny has been determined in his federal advocacy efforts to prevent the erosion of the Critical Access Hospital Program. He has reached out time and again to state and federal legislators to explain the transformation taking place in the healthcare system and the pressures being put on Kansas healthcare providers. Denny also has served KHA in many different capacities. He's been a member of numerous KHA committees and task forces, including the Council on Policy and Advocacy, the Council on Health Delivery, and the Task Force on Patient Safety and Public Confidence. Denny also has been a member of the board of the Kansas Hospital Education and Research Foundation, serving as chair in 2008. Since 2010, Denny has been a member of the KHA Board of Directors. In every instance of his involvement with KHA, Denny has provided thoughtful, proactive leadership to help guide us in the right direction. Denny is a fellow in the American College of Healthcare Executives. Perhaps among his greatest contributions on the national level is his support of ACHE. Not only has he remained disciplined in maintaining the best practices of this organization personally, but he has also helped many younger associates enter and advance in this organization. Denny has 3 children, which he enjoyed coaching in baseball over the years. His children, Blair, Carrie, and Glenn, are now married and have 3 children each, giving Denny 9 grandchildren ranging in age from 3 to 12 years old. Sheila and Denny have been married 15 years. They enjoy live blues music and have attended numerous motorcycle rallies. Bikes, blues, and barbecue in Arkansas is one of their favorites. Denny has served on the board of the Southeast Kansas Mental Health Organization, in which he was appointed by the County Commission. He's been a part of the Knights of Columbus, the Lions Club, and he is a member of the Holy Angels Catholic Church in Garnett. He likes taking care of patients and feels his role of administrator, in which he can support those who take care of the patients, is an important part of the patient care experience. Denny is proud of the success of Anderson County Hospital. From being the 2nd hospital in the state to apply and receive critical access hospital status in 1999, to the new replacement hospital that will open in a few months. But Denny feels his greatest achievement is his kids and family. He is very proud of Sheila, his children, and his grandchildren. When you consider all Denny has given to KHA and the hospitals of Kansas, it is hard to think of anyone more deserving of this honor. His leadership, teamwork, and commitment to do the right thing during his 50 years in healthcare is impressive. The Kansas Hospital Association would like to congratulate Denny Hachenberg, the 36th recipient of the Charles S. Billings Award. Thank you, Denny, for your distinguished service and the unforgettable mark you have left on healthcare in Kansas.